So in this episode, we're going to be talking about odontogenic tumors. This first one is called an odontoma. You separate the words odont, meaning tooth, and then oma, meaning tumor. A tooth tumor? Yes, a tooth tumor. So these can be separated into two different categories. We have compound and complex. These basically resemble teeth and dentin and enamel, and it gets a little messy. So a compound odontoma is going to be basically a collection of small, numerous teeth. These are going to be more anterior to the maxilla. The teeth are going to be radiopaque, and it has a radiolucent halo. Complex, that's going to be found more posterior in the mandible. It's going to be a mass of enamel, dentin, cementum, and pulp. It's going to be a radiopaque mass with a thin radiolucent halo. These need to be surgically removed. Here we have a cementoma, or cementoblastoma. These are going to be a mixed radiopaque radiolucent mass lesion on the apex of vital teeth. They're mostly common on the mandibular anterior teeth, and they are prevalent in African American women, and they're painful. The tumor itself is radiopaque and has a radiolucent halo. Here we have an amelioblastoma. These are usually multi-ocular radiolucencies, soapy bubbles, kind of like the aneurysmal bone cyst. So it can be soapy bubble or honeycomb radiolucency. They're most common in the posterior of the mandible, and they have a high reoccurrence rate. And they're also encapsulated. What it does, it infiltrates surrounding tissues and causes destruction. If it's in the maxilla, usually it kind of causes death into the vital tissues and structures and can go to the brain. And if it's in the mandible, 80% of it is going to be basically have an expansion of the surrounded bone, and it's going to swell and get bigger. So just like the cementomas, we also have periapical cemental dysplasia, also known as a false cementoma. So these are mixed radiopaque radiolucent lesions at the apices, common in the lower anterior teeth, and they are also involved in the vital teeth as well. There's no cortical bone expansion though. They are more common in middle-aged African American women. Here we have multiple myeloma. So this is bone marrow tumors. Poor prognosis and often fatal. This causes anemia and painful bone. It's punched out radiolucent bone, including the jaw. You can kind of think of like Swiss cheese. Here we have florid cementoosseous dysplasia. It can be bilateral and multiple radiolucent or radiopaque lesions in the posterior jaws. It's kind of like the periapical cemental dysplasia, but it's widespread. And it can be both sides in all quadrants. The teeth are going to be vital. The lesions are usually asymptomatic unless it's infected. Let's quickly go over this again. Periapical cemental dysplasia, it's localized to the mandibular anteriors. Florid cementoosseous dysplasia, same lesion but everywhere. Cementoblastomas, they are radiopaque and fused to the root. Multiple myeloma, they are punched out radiolucencies. And ameloblastomas, these are going to be multi-ocular and expansive.